All right. Good evening and welcome to our would be I think fourth webinar for the Chicago Institute of Advanced Surgery. This webinar is today was chosen based on many requests to go further in this topic that was part of our first webinar about bariatric surgery. It seems like our dietitian and physician assistant were so much more popular than the surgeons, and many people wanted to hear more about diet and exercise and so forth. And we wanted to go back to talk about these things. My name is Rami Lutfi. I'm a bariatric surgeon, and with me is Dr. Eric Veilleux, our fellow, who is a surgeon already, but specializing to be a bariatric surgeon. And next to him is Mali, our physician assistant, who pretty much runs our clinics and take care of our patients' health if we are stuck in the operating room. And she makes sure that we have our patients have access to a healthcare person anytime. And next to her is Emma, our program coordinator, who's also a dietitian, and she works with our patients on all the diet stuff. I will say that we are all in the same place. Actually, we're all in our office in different rooms. Although the backgrounds seem a little different, but we're all in different rooms, and this is very exciting to me because after many weeks of the lockdown, we are back in the office. And not only this, it seems in the next couple of weeks we will start doing bariatric surgery again after 8 weeks pause. I know, and I apologize to some of you on the webinar who were scheduled for last week and this week. We kept delaying you because we are still working with our hospitals and the local authorities with the government at a city and state level to make sure it is very safe to have surgery and have the hospital be equipped to have inpatient. We still in our program keep everyone overnight for safety and not do purely outpatient surgery. So the hospitals have to be on board. With that being said, we really are going to be starting bariatric surgery, like I said, in the next couple of weeks. We have a good reason to believe maybe the second week of June we should be active. Today webinar is probably the most talked about subject in our office and our clinic, which is what's going to happen after bariatric surgery. Many patients come to see us and tell me that they've been thinking about this for a while, but their cousin had surgery, had a gastric bypass, lost 150 pounds, and regained all the weight. Or the neighbor had a sleeve gastrectomy 5 years ago and now can eat a full cheeseburger and fries. And there's a thought that bariatric surgery does not work in the long term. Obviously, the data shows the opposite. Maybe there are patients, like any other procedure or surgery, that regain weight after surgery for poor, what we call maladaptive eating habits or lack of exercise. But at least over 2/3 of our patients maintain good weight loss, even though at 5, 10, 20 years from surgery, we are 20 years older and we may gain a few pounds, but like I said, 2/3 of the patients should really keep more than 50% of the weight loss in the long term. Today, we are going to look at this and see further through Dr. Veilleux, who's going to talk more from surgical standpoint, what is really behind weight regain and what can we do to what we call take care of that new stomach, the newly fashioned stomach. How do we keep it tight and nice and small and not abuse it with how we eat and what we eat every day. And then really probably as important or even more important, what's the diet and exercise and the behavior that will allow our results to be more sustainable and drag our success for years to come. Bariatric surgery should provide a long-term solution for morbid obesity, and we want to work with our patients through the rigorous follow-up we have here. Many of our patients stop coming because they lose the weight, but we try to encourage everyone to continue to come to work with them to drag that success long-term. That's really all I have to say. I'm going to leave it to the expert and watch with you all. It's a good evening here in Chicago. The weather is nice. I hope we're not taking valuable time out of your day. We're definitely all had so many webinars. It's tiring. So we'll try to have some fun. Keep your questions coming. Eric and I will look at the questions and address hopefully all of them, and those that we don't, we will reach out to you personally to make sure everything is addressed. Thank you, and I will disappear now, right? Eric, you want me to disappear? A lot of people want me to
That sounds
disappear.
good.
Wow, you're not supposed to say that live, but all right, we'll let Eric go.
All right, thank you for that introduction, Dr. Lutfi. Again, the topic of today's webinar is really success after surgery, and how do we make sure that that success is sustainable. So as always with our webinars, we want to invite you to ask any questions. This arrow here is kind of pointing to where the question box is if you're on a PC or any kind of computer. I think if you're on a phone, you'll have to find the questions in the menu. But please, when we transition between our speakers, we'll try to answer questions then. And as always, at the end of our webinar, we will answer some more questions. So that's one of our favorite parts of doing these. So what I'm going to talk about here is really centered around what we hear asked pretty frequently from our patients. A couple different topics that seem to always be on your mind. I'll start off with, you've had the surgery. Congratulations. We are all very passionate about bariatric surgery, and we really do believe that this is the beginning of a healthier you. It really is the beginning of changing a lot about your life and your lifestyle to improve your health, any of the possible diseases that you've unfortunately developed because of obesity. And we're here to help you along the way, and we can't wait to see how you do. Now, what we like to tell everybody is really, you've had the surgery. Now, let's see about making changes across all aspects of your life. And this isn't something that we really always take into consideration. But to keep on track, this really might involve thinking about what you do for fun. I know a lot of us, we get together with our friends, maybe after work, maybe on the weekend. And this involves going out to dinner. It involves meeting in places where there's drinks, there's food that's not prepared by you. And so really afterwards, when weight loss is your main goal, we still want you to have fun, but you really have to think about how that temptation, how that food that's prepared and brought out to you might really impact what your overall goal is. And so instead of going out to eat, instead of meeting up in these places where there's food, you have to think about where you're going to prepare most of your meals. And really thinking about portion control and preparing healthy foods at home is a great place to start. In addition to that, if you quit smoking for surgery, we applaud you, and we say definitely continue to quit smoking after surgery. If you quit drinking alcohol for surgery, continue that afterwards. Unfortunately, alcohol, beer, and hard alcohol is empty of calories, and it really is not something that factors into your overall weight loss goals. We also encourage you to follow up with all of your doctors regularly after surgery. That includes us. We have plenty to chat with you about, plenty to help you keep on track after surgery. but also that means your primary care doctors. You might have an endocrinologist, you might have a cardiologist. All of these doctors, it's great to keep them updated on how you're doing. And why is that? Well, lots of the diseases that are going to be improved after this surgery, like high blood pressure, diabetes, cholesterol, you see here sleep apnea, these are all things that you might have rapidly improved after surgery. And so your medications may have to be altered. They're most likely going to have to be decreased. You may no longer need a CPAP machine if you have sleep apnea. And that's why it's very advantageous and very smart to keep updating your doctors and see everybody pretty frequently here. Now, weight loss, what to expect? We get this question a lot because it's very easy to read about other people's experiences online, how fast they're losing weight, and you think about yourself and you say, well, I don't seem to really match up with those people that I'm reading about. And I'm here to tell you that that's totally okay. Why? As your surgeon, I'm telling you there's no expected rate of weight loss here. Everybody is going to be individualized. Everyone's going to lose at their own pace. You might hear about somebody who loses weight rapidly in the beginning, and you're going to hear about somebody who doesn't lose weight rapidly in the beginning. Maybe towards the end, they found what works for them, and now in the second half of the year, that's when their weight loss comes from. I'll show you quick a graph here that we often use just in an estimation. So this is a graph, it's the average data of a lot of people. And as surgeons, this kind of gives us an estimation of what to expect for certain people. So we plug in your height, your weight, any comorbidities, and it creates for us a graph like this. And at the bottom, you see months after surgery. And so the reason I show you this graph is really to point out that for the average person, and again, there's going to be outliers. So if you are an outlier and you don't match this graph, that is perfectly fine. We're here to find what works for you. But just to show you that in the average accumulation of data for everybody, in the first half of the year is when we see a steeper slope of weight loss. And then towards the end, for the last 6 months, it starts to level out a bit. And so again, why do I show that to you? Well, if you're part of this average group, this is why we really want you to try hard in that first part of the year to get everything on track and to capitalize on this ability to have a more rapid weight loss, so that then towards the second half of the year, you can continue with those great behaviors and really maximize your goals by the end of that first year. But really, I think what's most important is to understand your weight loss. And what do I mean by that? What do I mean by understand your weight loss? Well, you want to keep track of how you're losing weight. And if, say, you've stalled for a month, you want to understand, is that a plateau? Is this something I have to talk to the Lutfi Forward team about how to break through? You know, are you regaining weight? Come and discuss with us the possibilities of why that might be happening. And then really think about, well, has your diet changed? Can I think about the last month or two? Did I do something myself which might have caused this plateau or this weight regain? Or has my activity level changed? Have I unfortunately been met with quarantine and I've been stuck in the house for the past month? But this is why I think it's really important to always follow up with us. Ask us these questions about your weight loss. Don't sit at home. Don't be embarrassed above all. And don't be confused by your weight loss, because we're here to help and we love to talk about it. It's really, it literally is what our job is. For the next topic here, I want to talk about taking care of your stomach. And as Dr. Lutfi alluded to, you know, this sleeve isn't the end of thinking about what you eat, or it isn't the end of how you take care of your stomach. And I think this is really an important topic when we think about the long-term goals here. So right after surgery, when you're thinking about your portions, you're thinking about satiety, what makes you feel full? Well, right after surgery, your stomach is still a little bit swollen. It's still healing. It's a little bit smaller than it's going to be. It might stretch a little bit. So in the very beginning, your stomach's going to tell you when you're full. And if you've already had the surgery, then I think you know what I'm talking about. Very small portions, you feel it right away. You know that you're full because you might feel a little twinge, a little bit of pain, maybe a small bit of nausea. And that's when you know that you're full. Well, what I'm here to tell you is that after the first couple months, don't listen for that signal anymore. You are the one who's going to tell your stomach when you're full. Your stomach is going to serve you. You're not here to serve your stomach. And why is that so important? Well, eating to the point of feeling full, feeling that little twinge inside of you, is actually something that's going to slowly stretch out your stomach with time in the first year. It is actually possible to lose your restriction, both with a sleeve and a bypass. And that's because every time that you're eating to the point of feeling that little twinge, it means that your stomach is at capacity, and it's going to keep getting slightly larger if you keep eating to that point throughout the first year. Now, a certain small loss of restriction is pretty expected, and if you followed up with us and you're at the end of your first year, I know you've heard us ask, where is your restriction level at? Do you feel like you're at 90%? Do you feel like you're at 80%? And I don't know that anybody's really told us they're at 100% at the end of a year. There's always a small amount of loss of restriction that we expect, but the goal really is to prevent this as much as possible. And by acknowledging what I'm saying here, by acknowledging that you want to keep your portion size consistent throughout that whole first year. So once you identify what the right portion size is for you in those first couple months, try to keep that consistent throughout your first year, even if you find it's not making you generate that feeling in your stomach anymore, because that's not what we want. So practice mindful eating, mind over stomach, and I think that's going to really lead you to a greater amount of success here. Now, finally, if you're somebody who suddenly does feel like you have a loss of restriction, you feel like you can eat more, maybe you can eat double what you did what you could at first after surgery, don't wait, don't ponder that. Let us know, because there's potentially things that we can do to help you understand. There's potentially things that we could do to study your stomach. We don't want you to wait until you start regaining weight. And it's not the end of the world if you do, but it's something that we'd love to help you with. We can do imaging and x-ray. We can take a look from the inside, really take a look at how your stomach is faring these days and see if there's anything we can do to help you. All right, so now you've had great success. You've lost the weight. Congratulations. But some people ask us, well, what should I expect at that point? And really, one of the questions that we get very frequently is either will I have excess or loose skin after I lose weight, or I have excess or loose skin, what can I do about that? And we acknowledge this, significant weight loss comes with many, many rewards. And I don't want you to ever forget that. It comes with improved health, improved energy, so many rewards, but sometimes it does come with excess skin. And that's because during your period of weight gain or during your maximum weight, your skin has actually had to stretch out. And depending on your genetics, depending on exactly where you carry your fat in your body, everybody is a little bit different. And depending on the elasticity of your skin, will all factor into whether or not that skin is able to recoil out, or if there will be some excess generated after your weight loss. Now, we typically see some of these problem areas in the upper arms, in the lower belly, around the hips or thighs. And why is that a problem? Well, it can potentially cause some chafing or rashes. Some people even notice some muscle strain because it's throwing off their gait a little bit when they walk. What I want you to know is this is treatable. It is a treatable representation, exactly what it says here, of the journey that you've made and your success. And the treatment that's available is plastic surgery. We can refer you to a number of plastic surgeons who we trust. And you may hear this called all different names: body contouring, a body lift, arm lift, tummy tuck, abdominoplasty, all names for the same great thing that help you deal with this excess skin after you've had such great success with your weight loss. Another question we get is exactly when am I a candidate, or when should I start thinking about having this skin removed? We recommend after surgery you wait about 12 to 18 months. Now, not only has this kind of allowed you to maximize the optimal amount of weight loss from your surgery so that you're probably at a steady state in your weight, we really want to see you be at a stable weight for about 3 to 6 months, and probably somewhere around 10 to 15% of your goal weight. And once you're in this zone, again, this is a recommended zone, but once you're in this zone, I think we'd all say is an excellent time to pursue having that skin removed. Now, definitely check with your insurance, check early on, even before you're in this zone, because in some cases, these procedures will be covered by your insurance. And again, we are more than happy to refer you to our plastic surgery colleagues for a consultation on this. Now, I'm going to end here by talking about weight regain. This is not what we want, but again, it is not the end of the world by any means. We all here recognize that obesity is a disease and it's a chronic disease. You've probably heard us tell you that it's something that we are unfortunately going to be with you battling for the rest of your life. So weight regain for many people may be something that you find is happening. Don't wait, call us. There's a lot we can do to help. Our dietitian is here and available 5 days a week. She's always happy to discuss healthy eating tips and habits with you. And in addition, all of the surgeons here are happy to schedule an appointment to evaluate and work with you and to identify exactly what's happening, what's causing this weight regain. We can study your anatomy. Again, we can take a look from the inside with x-rays. And in some cases, some patients may be candidates for revisional surgery or for conversion, say, from a sleeve to a bypass. We don't consider this a failure by any means. We consider it just another way that we're combating obesity in the long term here. All right, thank you all for listening, and I'll pass it back to Dr. Lutfi for now.
Here we go. Let's see. All right. This is great group. I've been busy typing answers. Thank you for those who had questions. Dr. Veo, many questions, none for your particular topic, but there's a question that was not typed, at least the question that I saw. But I want to ask you that many patients come and ask me, which what you alluded to, I had a sleeve, I can eat much more, I did all the dietitian stuff, went back on liquid diet, lost 10 pounds, blah, 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 but I can eat more. I think my sleeve is stretched. Can you re-sleeve me? This word re-sleeve, I know you're becoming an expert. I know we reviewed a couple of papers together about re-sleeves, and we know it's very common in Europe. We have a couple coming up. Can you talk a little bit, what is a re-sleeve?
Absolutely. As you mentioned, this is something that's somewhat new for us here in America, but has been studied more extensively in Europe, and we have reviewed those papers. Just to break it down, so when we do this studying of your sleeve, and potentially to see if it's stretched, we do an upper GI, we swallow contrast, and it might show us that the sleeve is, say, double the size that it was after surgery. And so what that lets us think about is, all right, so we know you had success at first, you lost a lot of weight, but unfortunately your sleeve has stretched. Well, if bringing your sleeve back to the same size that it was when you had so much success is possible, maybe this is going to bring you more success in the future. And so what we would do for you is very similar to what we did in the first procedure. It would still be done laparoscopically. It would still involve stapling and sealing up the stomach. And basically that excess, that stretched stomach that has grown over time, we would just remove that. And so instead of having about 80% of your stomach removed as you did the first time, we would just remove whatever excess we feel has grown since the last procedure. Now, again, similar to how the sleeve was once a new procedure here in this country and now has enjoyed wide success, I think we would agree that re-sleeving is also now for us a somewhat new procedure and still needs to be studied to see how exactly successful it is going to be. But it's very promising what we've already seen as far as the data from Europe.
All right. Next is Emma, I believe. And Emma's gonna, it's just so good to have you, Emma, part of our team. I think Emma revolutionized our team and our clinic. She just is such a great dietitian. I'm learning much from her. I think I lost, what, 6 pounds, Emma? with your help and with the protein bar from Eric. Counting calories is very important. And we just had a new council today that was asking, am I going to be in starvation? I don't know if I want to have bariatric surgery. I like to eat. Am I going to be miserable and not eating? So, Emma, do you want to talk about this? I like the title; is very appealing. So I'll let you talk, and I'll disappear again.
Okay, yeah. So being able to maintain your desired weight loss or how to sustain a weight loss after bariatric surgery is a question and concern we get a lot. And as Dr. Bayer was saying, eating is very different after weight loss surgery, and it's not a quick fix. You know, you will need to be making smart nutrition choices and practicing portion control lifelong after surgery. And there is no one special, one size fits all diet. It's all about incorporating healthy changes and habits that can be sustained for lifelong after surgery to support that healthy lifestyle. And making sure that you are managing your caloric intake is going to be a major part of that. So overall, weight management comes down to calories taken in, calories you expend out.
This is something you can share.
However, all calories are not created equal in terms of keeping you full and satisfied, as well as the micronutrients they contain. So for example, 100 calories of grilled chicken will help keep you satisfied and full for longer, as opposed to 100 calories of chocolate. So after surgery and when hitting a plateau, managing your caloric intake to provide you with the most energy to keep you satisfied is so important. And you will need to be choosing nutrient-dense and high-volume foods to help manage that caloric intake, as well as being mindful and stop eating when satisfied instead of stop eating when you feel uncomfortable. As Dr. Bayer was saying, continually eating past satisfaction can lead to stretching and loss of restriction. Now, I do want to be very clear that the role of exercise in a healthy lifestyle should not go unnoticed. Exercise can help you build muscle and maintain bone strength, can help increase weight loss, and also prevent future risk of chronic diseases. However, when it comes to which is more important, you cannot out-exercise a poor diet. You know, it's much easier to consume 200 calories in 2 minutes, and as opposed to, you know, that would take hours to burn off a vigorous activity. So really making sure that you are choosing lower calorie options. And so there's a couple of tips that I always give people who are asking easy ways to cut calories. The first thing I recommend is cutting out all sugar sweetened beverages. And so I don't just mean soda, things like juice, alcohol mixers, and alcohol itself, any like sugar sweetened coffee drink. These things have a lot of calories and a lot of added sugars. So added sugars are just kind of useless calories. They don't really give us that much energy or provide us any more protein or fiber. So the first thing to decrease your caloric intake, I recommend cutting those out. 1 glass of orange juice, and when I say 1 glass, I mean 8 ounces. For reference, a can of soda is 12 ounces. So even less than that, 8 ounces of orange juice has more sugar than a cupcake, whereas 1 can of Coke has the same amount of sugar as 3 glazed donuts from Dunkin' Donuts. So just trying to illustrate how much empty calories are in just one beverage that doesn't really even satisfy you. The second thing I recommend when trying to decrease calories is choosing low-fat or calorie-reduced dressings and sauces. These things can really pack a punch in terms of calories, added fats, and added sugars without you even noticing. For example, regular ranch can have up to 200 calories per serving. So if you would have just switched to a lower calorie ranch, over 1 year, you could save up to 8 pounds in calories. So being able to consistently maintain a weight loss after surgery heavily depends on incorporating small changes like that may not seem like much at first, but over time will show improvements if you stay consistent. And to save calories when still eating your favorite foods, I strongly recommend making them at home, and that's going to be crucial. So taking a cheeseburger, for example. On the left, I have included a picture of a cheeseburger from TGIF. This is actually 780 calories, where if you were to make that at home with the same ingredients, you could save 300 calories. So trying to make sure that you're trying to eat food at home more, and kind of going off Dr. Veyer was saying, that going out to eat is a fun social event, but after surgery, you need to be changing those habits. So instead, trying to have friends over and make food at home to make that a healthier option and decrease some of those calories. Because even sit-down restaurants have a lot of added sugars and oils to their foods, so calories can really add up fast without you even realizing it. Now, there are many substitutions that can be used in cooking or at meal and snack times to easily decrease the calories you are consuming. And incorporating these small swaps or changes consistently can really, over time, make a big impact. And so, for example, to start, instead of using butter and oil in cooking, trying to switch those to bananas. Bananas give the product the same consistency and have a lot less calories and a lot less fat. So that's one easy, simple change that you can just try to incorporate to decrease those calories. Now, I'm not saying go and make cookies using bananas or brownies using bananas every day, but this is something that you can try to incorporate every once in a while on special occasions to decrease your caloric intake. Now, this next one, using Greek yogurt, plain Greek yogurt, in substitute for mayo or sour cream is something that is a really simple, quick fix that can increase your protein intake, decrease your fat and calorie intake. And when you use it in sauces, like the recipe I included, you can barely taste that it's plain Greek yogurt. So trying to incorporate that is something easy that you can do to help shave some calories off, as well as using riced cauliflower instead of rice. And I know I've talked about this before, but it is a really good texture substitute that has a lot less calories and a lot less carbohydrates. Now, kind of going off back to the sugar sweetened beverages item, adding cream and sugar to your coffee can really rack up calories over time. And if you're like me, you drink coffee every day. And so if you're adding that much calories every day, it can really stack up. So 2 tablespoons of creamer can have 70 calories. And if you were to use Premier Protein instead, that would save you about 56 calories a serving. So that's pretty huge. Premier Protein is really high in protein, low in calories, and low in sugar. So I recommend if you mix that with your coffee, it can help keep you full for longer, actually, and will decrease some of that calorie, as well as add that creaminess to it and flavor. And lastly, trying to swap out trail mix and use popcorn or rice or Cheerio cereal instead. Nuts and dried fruit are really good for our health. Nuts are a great source of fat and protein. However, a small amount of nuts has a lot of calories. So trying to switch and add in popcorn and cereal to your snack mix or trail mix, if you're a snacker like me, that can really increase the volume of the food you're eating, but also decrease those calories greatly. And so that is all I have. I have my contact information. I'm happy to send these slides. I know there's a lot of recipes on them. We'll also post them to our website. I'm also happy for any question, to answer any questions or set up any one-on-one appointments with you guys to see if we can push past your plateau.
I think I muted you there, Dr. Luffy. Now you're unmuted.
Yes, thank you. Thank you. And I'm sorry if you guys overheard me trying to talk, trying to answer all these questions, but thank you for muting me, Eric. 2 questions from the same person, but since she is one of our favorites, we're gonna address both her questions. I'm mad at her because she's not following up. She lost a lot of weight. She looks great, but she's not following up. But I'll be nice and answer both her questions. She knows who she is. Okay, I'm gonna read the first question. I feel like everyone who is a couple of years out has probably has probably lost some restriction. How do you know if some is normal? How much should I be able to eat? Is there a certain number of calories, ounces of food per meal, something like that? I'm going to answer the first half, I'm going to let you answer the second half and the second question. Yes, just like we get older and our skin sags and we have wrinkles, the same thing with our stomach. The more we eat and force more food into our sleeve or gastric bypass at the beginning of the journey, when everything is fresh, the more it dilates and the less sustainable is our weight loss. But every pouch or sleeve dilates a little bit. Now, the hope is that you adapt. You adapt. So while the sleeve or the bypass initially will determine for you how much you can eat, you've got to get used to it and start finding ways to eat smaller amounts throughout the day, maybe 6 meals per day, 3 big ones and 3 small ones. And I mean big ones not with volume, meaning major ones, and 3 snacks. So you eat throughout the day and you keep burning as you go through the day. So when there's a little bit of dilation, you can deal with it. Let's put it this way: even if things dilate and allows you to eat a foot-long sandwich and fries, you should never eat that. You should get rid of the bread and the fries, maybe a few fries in the long term to be realistic, and substitute that with vegetables and some kind of healthy dressing with not much calorie. As Eric said, this is what's the sad reality. Obesity is a chronic illness. We cannot cure a chronic disease with 1 hour operation. Bariatric surgery does not cure obesity. It temporizes it and puts a hold on the progression and causes great effect on diabetes and so forth. So your body will always want to go back up, and you just have to go every day to war against obesity. And bariatric surgery is pretty good weapon to do, but that certainly the effect of that will decrease. Now, Emma, I'm going to let you answer this. So my pouch stretched a little bit. I can certainly eat more. This lady is asking, how much should I be able to eat? Is there a magic number with calories? Today, one of our patients asked 400 calories. Is that realistic? People cannot live off 400 calories. It's not realistic, right? I'd rather stay obese than live off 400 calories a day. So what is realistic, Emma?
Yeah, and so that answer will differ depending on if you're male, female, how active you are, and how far out of surgery you are. However, you will not be eating the same amount of calories that you could eat before surgery. If you're a female and you're a couple of years out, anywhere from 1,000 to 1,400 calories I'd be shooting for. Again, that's all going to be dependent. Like I said, it's not a one-size-fit-all. It's all about working what works for you and how you maintain your desired weight. And in terms of portion sizes, aiming to have 2 to 4 ounces of protein at each meal. And then kind of going off what you were saying, incorporating vegetables and fiber foods until you feel satisfied and not overly full.
Great. So please call us so we can talk more about these things. It's hard to answer with the time limit. But Emma, yes or no, will I ever eat 2,000 calories per day?
No.
Okay. Yes or no, will I, if I want to be successful, will I ever do 1,800 calories a day and expect to keep my 100 pounds weight loss?
No, and I will go back actually. If you were going to eat that much, you would just be gaining weight. You need to make sure that you are staying under. You definitely will not be eating the same amount of calories you are now. It's all going to be about portion control and choosing lower calorie options.
Okay. All right. Second question, same patient. Great question. Do you recommend we still have a higher percentage of protein in our daily macros if we are past hitting our weight goal? So I'm 300 pounds. I have gastric bypass. I'm 180 pounds. I feel great. My diabetes went away. Tell me about the percentage of protein, and should still, I'm in plateau. I'm loving life. Should I still concentrate on protein?
Definitely. You will need to be working to maintain your desired weight. It's not just you get there and then it's there. You have to work to stay there. And protein foods really help with staying full and maintaining your muscle mass. So I would definitely recommend trying to focus on protein food first, lifelong after surgery, and making sure you're getting in at least 60 grams a day. Definitely incorporating other foods as well, but you will need to work to stay at your desired weight, and having lots of protein can help do that.
All right. Thank you. Thank you. Let me shrink those questions, and a great job. Next is Molly O'Brien, our star and best physician assistant we have in the practice. Molly is going to talk to us. Again, she's I kind of get sad every time she talks to me. She just challenged me to do some push-ups, and I think they took a video of me, and I hope they don't post it online to prove how bad I am, but make my patients feel good about themselves when they compare to me. Molly is great always gives great education about ways to exercise, motivation to continue the great results, and so forth. And let's listen to her and learn a little bit. Thank you, Molly.
Thank you. Thank you. Now the question that I get a lot when I'm talking to a lot of people during their follow-up, so that motivation to push past your plateau. That plateau is definitely a trigger word for a lot of people, so we definitely wanted to go ahead and make this a relevant topic so that we can touch on this. So we'll go ahead and get started. So your plateau. So what is a plateau?
For those interrupt you here. No. I just want to make sure that your slides are working. I see that you're still stuck on your first slide, at least on my screen here. Let's just troubleshoot that really quick.
In the meantime, someone asked about Starbucks coffee. I'm not sure the question comes clear to me. Can you just maybe reword the question?
I think that might have been more of a comment on how much of that coffee you drink, Dr. Lutfi.
Well, you know what? That's bad because with my work, I have to add some Arabic coffee, which is very concentrated coffee that may keep some of you awake for days. So yes, all surgeons unfortunately drink a lot of coffee. But with Eric, Molly, and Emma, I stay on track. I'm too scared to cheat.
All right, Dr. Ver, were we able to? Can you see?
Just one second, I'm going to pull up your slides on my own here, and maybe we'll just run them from mine. All right.
I think my computer must be too old to handle this new technology.
No problems. We got many workarounds. Okay, how does it look on my screen here?
It is still blank. There we go.
All right. Just like we do in surgery, whenever there's a problem, we fix it. Good job. Good job. Team effort.
Thanks, Dr. Bayer. I appreciate it.
No problem.
All right. So like we were saying, so your plateau. So what is a plateau? So it is when you are neither gaining nor losing. You're kind of just stuck in the middle there. And, a lot of people are asking me, how do I get out of this? I have people that are, 6 months out. I have people that are 3 years out that are asking the same question. How do I get out of this plateau? I really, I'm doing a lot of things right, in my opinion. So if you're stuck in that plateau, you have questions, I definitely, as Emma and Dr. Vera have said, definitely always feel free to reach out to our office. We're here every day of the week, so we're more than happy to answer any questions specific to your experience. So just as we talked about with bariatric surgery, this is a journey. So plateaus are part of it. And the biggest thing that we go back to is we want you to remember when you first got in for that first appointment, when we asked you, why did you want to pursue bariatric surgery? What exactly was your why? So what do I mean by that? I mean, what was the reason that you wanted to go ahead and fight this fight this disease, obesity, that has been, you know, a chronic problem in your life, in order to have, you know, a healthier lifestyle? So reason being, you know, to have a healthier lifestyle, you know, not to feel limited by your weight. You know, we had a lot of people saying, I don't want to have that medicine cabinet full of medications anymore. I want to get off of all those. And then, I mean, there's always the one, you know, for family. You know, I want to be around for my grandchildren. I want to be around for my children. You know, so there's, you know, a multitude of different reasons why we want to go ahead and, you know, help you along with this journey. And I think it's really important to remember, when you are facing this problem, when you're at this plateau, what exactly was that reason? So I always get, you know, the question of, you know, I'm at this plateau, you know, I haven't seen that number budge one bit. You know, I'm working out, I'm doing a lot of exercise. I really want to emphasize that lean muscle actually does weigh more than fat. So the scale can be a little tricky when you're using it as a tool to kind of gauge how your success is. So, you know, other things to kind of look at besides that number on the scale: how your clothes are fitting, you know, kind of tracking your sizes, you know, or just the fit of your clothes, if they feel loose, if you know your shirts are feeling a little tighter from all those bicep curls that you're doing, you know. So definitely, you know, there's the actual clothes fit. There's also body fat. Some people get really work that body fat number is a big thing. Just your endurance level. You know, if you realize, hey, I couldn't walk a block when I first started, and now, you know, I'm walking, you know, 3 miles every day. That's another thing to kind of gauge as well. Next slide. So, post-bariatric surgery and working out. So I get a lot of people when I'm talking to them at 4 or 6 months, you know, we sometimes deem this the honeymoon period. You know, whatever you do, you'll lose weight. Now, when I start to see people at 4 to 6 months, they're like, I'm not quite losing the same amount of weight that I was losing before. So I do urge you that if you have not started exercising, go ahead and just do something, you know, whether it's walking or, you know, joining a class. Just go ahead and start something. We'll get into more information regarding specific things that you can do in a couple slides here, but just go ahead and start working. Now, for those patients that, you know, are like, I had somebody today tell me, you know, I'm working out 3 to 4 days a week. I'm jogging 2 miles every day. You know, I'm doing so much better than I was months and months ago, but, you know, I'm plateauing. The biggest thing I want to emphasize and just really work around is this idea of heart rate. So your resting heart rate, for those of you that have never heard this before, your resting heart rate is somewhere between 60 and 100. Now, when you're working out, you want to reach that maximum heart rate, which you can see on my slide here as a basic chart as far as what your maximum heart rate is. And so you don't want to achieve that maximum heart rate. That would be very high. You want to aim for that 60 to 80%. So, you know, that green area right in here, that's a good percentage to kind of be aiming for. And when you are elevating your heart rate to this point, you are, you know, you're increasing your intensity, you're burning a lot of that energy, you're burning a lot of that fat. So it's important to make sure that you're reaching this heart rate. Now, this is where it can get kind of tricky. When I was talking about the patient that, you know, has been running for months and months, 3 miles at a time, your body can adjust to the exercise that you're doing. So, you know, if you're running a mile every day, your body burns to a point where it becomes very efficient in how it's burning a lot of your energy. So your body gets used to it. There's a lot of data out there that suggests that you should be switching up your workout routine, believe it or not, every 4 to 6 weeks. So, you know, it's really important to, you know, get outside your comfort zone, try something new. You know, if you like running, you know, really try and do different variations of running, whether it's, you know, doing, I used to call them sprint jogs. So, you know, you sprint from one lamppost to another lamppost and then jog the rest, you know, working up and down with that high intensity level. So we can go to the next slide. So kind of going back here for a second. So for those that were, you know, haven't really started anywhere and just kind of want to start with walking, I got this really great walking challenge here that you can go ahead and start on June 1st. And it's just a good way to kind of work yourself up if you don't really have a baseline for any type of exercise right now. Just go ahead and just get started with walking. They have a great step metric here that, you know, we can basically see that 5 minutes equals about 500 steps. Do this 4 different times throughout the day, you're walking about a mile. Now, if you keep increasing this, like we were talking about, you're going to increase your endurance overall. Next. All right, so there are definitely some great ideas to mix up your routine, and, you know, fingers crossed, you know, over the next couple of months here, you know, we'll be able to go outside for exercise more and more. I have heard that some gyms are opening up the ability for small class sizes to do outside exercise in the next couple of months here. You know, so that's definitely a good option. And, you know, of course, with the weather change, I have heard more and more commonly when I talk to patients that, you know, they're much more willing to go outside than, you know, running in the 0-degree January, which is completely understandable. But, you know, ideas for mixing up your workout routine, you know, with cardio, you know, there's walking, there's running, there's the elliptical. Hopefully, knock on wood, we can maybe go to pools soon. That's always an option for those that have a lot of problems with, you know, knee pain or back pain. That's always a good option. That high intensity interval training. So what exactly is this? This is when you're mixing in that high intensity and low intensity, what I was talking about with even you can do it with jogging and running. So, you know, you sprint for 10 seconds and jog for 10 seconds, sprint for 10 seconds, jog for 10 seconds. So, you know, just going up and down with that heart rate, that'll really increase your exercise as well. Definitely there's some classes doing body weight exercise. You know, once you start feeling like you're very comfortable with, you know, your cardio routine, you can kind of incorporate, you know, working different muscle exercises. So there's lots of great workouts if you Google, you know, abs, biceps, curls, anything that you can imagine. There are a lot of different options to go ahead and look for body weight exercises. Then on top of that, of course, there's also the idea of supersetting exercise. I don't know if a lot of people know what supersetting is. So it's kind of this idea of high intensity interval training too, is that with supersetting, you're doing an exercise back to back. So let's say you do 20 jumping jacks back to back, and then you go right into a plank for a minute. So working back and forth, this really increases your heart rate and is a great example of a great exercise as well if you're, you know, looking for something different. Next. So the last thing here. So as you can see here at the bottom, you have all our Instagram handles here. And, you know, we are actually challenging all of our patients here, which you can use the hashtag CIAS Fitness Challenge. We're challenging everybody to a plank challenge starting June 1st. And we're going to start day 1 with 10 seconds. And we're going to work our way up here. So you can definitely, I would encourage you guys to go ahead and follow us. We'll go ahead and we will definitely repost any stories that we get, any, you know, any funny pictures or anything like that. You know, we definitely, we like to be held accountable, and just like we definitely want you to be held accountable for all the work that you've put in to this point with bariatric surgery. So, you know, we just thought this is a great way for all of us to come together and really challenge each other. All right.
Oh, I think you're still muted, Dr. Lutfi.
Sorry. At least I muted it when I needed to. Okay, great. This is great. So many questions, and good to hear from many people who we haven't heard from in a while. I tell you, this by itself gives the answer to the importance of follow-up. And I think if there's any lesson learned today, is that if you do not follow up and be evaluated regularly, you are gonna potentially gain weight. We all know that people who struggle with their weight know a lot about their body and weight loss, but it's very different when you're evaluated professionally by someone who just look at you, your numbers and your trend. As we have shown many of our patients, we show them the graphs of their weight loss, you know, up and down, and it's good to see these things and come over. Many of you who reached out with your questions are struggling, and makes me sad to know that and not be aware of it. Even though we try to do a good job with calling and reminding our patient, but today we have about 3,000 patients in the loop, and and it's just becoming unrealistic. So please call us and continue to come. We have 5 more minutes. So I'm going to ask Molly. There are a couple of questions about people with certain body aches and so forth, wanting to do the plank challenge, and I responded to call you so we don't discuss personal health problem for HIPAA reason, you know, and please call us. I'm not going to do this challenge unless you really force me, because I'm embarrassed. I'm out of shape. I have the same excuse as all the patients. So I have to secretly practice before I do the videos, because I know Eric is waiting to make fun of me, and I'm sure
Never.
Emma and Molly as well. A question for you, Molly. I'm a young person who had bariatric surgery, and my trainer keeps telling me, you know, forget about the cardio. I want you to do a lot of weightlifting, because after bariatric surgery you tend to sag and this and that, and you know, weightlifting will shape your body. I'm 3 months out. I stopped doing cardio. All I want is for me to look good at the end of the day. And is this good to do a lot of weights, or cardio is better, or how should I think about it?
Yeah, great question. And we do get that question a lot, actually. And you know, I definitely emphasize cardio over everything else that first first year to year and a half, and you know, lifelong cardio will take you really far. It's a great exercise for your heart, on top of, you know, you have a lot of fat to burn. So the best way that you're going to do that is going to be with cardio. You know, you can't really tone too much at this point, especially, you know, 3 months out with that patient in particular. You really want to work on, you know, burning as much fat as possible, and then we can worry about the muscle toning. And you know, you can definitely do those exercises too, but I would definitely emphasize the cardio above everything else.
Okay, there are so many questions more, and we'll reach out to those we couldn't answer. Emma, my friend, I'm poor. I have limited budget. Healthy food is expensive. Is that true? Should I be sad that I cannot afford going to Whole Food? Should I feel that those protein bars are too expensive? What can I do with my limited budget?
No, that's a good question. I get this concern a lot, actually. You don't need to be going to Whole Foods or buy any expensive protein supplement to meet your weight loss goals. We can definitely meet you where you're at. Healthy food in general, whole foods like produce, even canned or frozen produce, and proteins overall are not very, they can be managed in a budget. They're not very expensive. You can save a lot of money by making your foods at home and not eating out. And trying to just do money saving techniques. I know I touched a little bit about this at our first webinar, which is posted on our website if you do want to get any specific ideas on how to have sustainable shopping and save money. But no, you definitely do not need to be going to Whole Foods or buy any special supplement.
Great. Well, it's 6:59. Time to go get that healthy meal and exercise a little bit. I want to thank you all for coming. It's very important to us to continue this. It's been great to connect with people. I certainly saw many people names who are very dear to my heart. And please follow us on Instagram and Facebook and all these things that I don't understand much. We are also going to put that webinar on our website, drlutfi.com. And have a great evening. And please come back and follow up if you haven't. And be safe. Thank you and good night.
Take care.